Dr. MacNichol, we talked about ablation, we talked about spinal cord stimulators. Do you do these procedures in the office, in our procedure room?
I'm glad you asked that. The ablation procedure can be performed in the office, but my experience has been most people appreciate the benefit of having a little bit of IV sedation, so I do that in the hospital. It's an outpatient procedure. They generally take 30 minutes or less, but it is normally done at the hospital. Now, the stimulator is done a little differently. The stimulator, the permanent stimulator that I just demonstrated here, is a permanent fully implanted device, and it is done at the hospital. But because we want to make sure we're only offering this implanted procedure to people that will benefit, we do a trial that is done in the office. I perform that procedure. The permanent implant, I generally rely on a spine surgeon to do that because the type of lead is sewn in and it requires a small surgical procedure. But the office procedure I do with local anesthesia. It's not a whole lot different than the epidural injection. I take a needle and basically insert a needle. Once again, I'll use the model here. Insert a needle between the vertebra, and I'll thread that little wire that I showed you through the needle. Fairly simple process. Under X-ray guidance, I thread the wire on up to where it needs to go.
So you know exactly where you're going to put this.
See exactly where it is. I know exactly where it ought to go. And once it's in place, I will test it by putting a small stimulation on it and demonstrating that you do feel the stimulation where the pain's been. So it's a simple procedure that takes 30 minutes or less. When you leave the office, you know for sure that the stimulation is covering the pain. You have a week of time to test it out and go about your normal daily routine with the trial temporary spinal cord stimulator. After a week, you report back to me, let me know how well it worked. If you thought it was extremely effective for pain relief, and oftentimes it's very effective, then we take the trial out and refer you to the surgeon to put in the permanent one in the exact same position. If you didn't get a benefit from it, well, that's good that we did the trial because we saved you an operation that was not going to help you. In my experience, we're pretty selective. We recommend the stimulator trial for people who we think are going to benefit it, and probably 90% of the people that we offer the trial for end up going forward with a permanent stimulator.
90%. That's truly an amazing number in medicine.